Welcome everyone to today's webinar, Built for Growth, How ASCs Can Capitalize on the Expanding Outpatient Portfolio. I am Angie Stewart with Becker's ASC Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log in to today's webinar to access the recording. On today's webinar, the topics we will be covering are new and emerging opportunities in the ASC space, strategies to capitalize on key opportunities and support long-term growth, embracing change and innovation to increase efficiency and improve patient outcomes, and tips on managing through the process of building a new facility. Before we begin, I want to share a little bit about our sponsor, Cardinal Health. Cardinal Health is a recognized leader with a top ranking from Gartner for transforming the healthcare supply chain to meet new challenges around costs, revenues, and outcomes. Cardinal Health is a leading medical and surgical distributor for surgical hospitals and ambulatory surgery centers because they have products and services dedicated to this market. In particular, ASCs are able to leverage resources to improve efficiency in their supply chain, such as a clinical team of perioperative nurses with an average of 20 years of OR and supply chain management experience, and their dedicated team of ASC reps with experience in supporting the setup of new facilities. At this time, it is my pleasure today to introduce our speakers, Helene Levinson, Senior Consultant of Clinical Operations for Cardinal Health, and Meredith Worf, Administrator for the Surgery Center at Mississippi Sports Medicine. Helene has over 33 years of clinical healthcare experience, 28 of which have been in the operating room in a variety of capacities. Since joining Cardinal Health in 2016, Helene has participated in clinical and supply chain assessments, custom procedure kit program builds, and reviews and led product conversion trials in a variety of ambulatory surgery center spaces. She has worked closely with strategic accounts, identifying savings as well as efficiencies. Meredith began her career with PricewaterhouseCoopers in public accounting with work focused in the manufacturing and healthcare industry. She then obtained her doctorate in physical therapy, advanced sports certification, and worked in the clinic at Mississippi Sports Medicine for 8 years before transitioning into the administrator role at Mississippi Sports Medicine's ASC 2 years ago. The Surgery Center at Mississippi Sports Medicine moved into their new 60,000 square foot state-of-the-art facility with 11 ORs about 2 months ago. Helene will now share some of the key industry trends for ASCs.
Yes, thank you, and good afternoon, everyone. Thanks for joining us today. So the trends for outpatient surgery is really changing. Nearly 60% of outpatient surgeries will take place in an ASC setting in the year 2020. This is an increase of 46% since 2005. Some of that change is due to the change in regulations and opportunities that are now available. Some of the highlights for the regulations for 2019 are site-neutral payment rule, inflation-related differentials, increase in surgical procedures payable to the ASCs, new device-intensive procedure threshold, and ASC quality reporting program. One of the biggest changes has been the opportunities for the ASC space in total joints. CMS proposed adding total knee arthroplasty to the ASC covered procedure list, and in addition, CMS also proposed removing total hip arthroplasty from the inpatient only list. With all these changes and trends that are coming about, we have Meredith here today with us to discuss the Mississippi Sports Medicine facility that recently opened. Meredith, can you share a little bit about the facility and how some of these trends influenced opening this facility?
Yes, I will, Helene. Thanks for having us here today. Just a little bit about our company as a whole to begin. About 30 years ago, 3 orthopedic surgeons formed a group and decided that they would make a commitment to serve the community and all the area high schools and universities with the most subspecialized, excellent practice that they could. And 30 years later, they are now a 17-member practice. They also have committed to serve the future generation of surgeons, as we are. We host 5 ACGME accredited sports arthroscopy fellows, as well as 2 adult reconstruction fellows every year. It's a big part of who we are and what we do. We have a full service line practice, meaning there is in-house physical therapy, occupational therapy, sports performance, X-ray, MRI, CT, pharmacy, and then also the surgery center. So Mississippi Sports Medicine began the Madison Physician Surgery Center, the previous center to this one, with 4 operating rooms 4 years ago. And with that, we began, as Helene said, looking at these opportunities several years ago and decided for us the best next steps for our practice would be to build a new de novo center. Again, with our primary focus and priority always being patient experience and safety.
Meredith, since opening this facility and incorporating everything under one roof, can you tell us a little bit about the patient experience when they come to your center for surgery?
Yes, so there are many benefits to having a one-stop shop, so to speak. The Flowood campus is one of 5 locations that we have, but it is the only location that is a campus-based model. So, if you're a patient, you can walk in. Let me give you 2 scenarios. You could walk into urgent care and have an issue with your wrist, and then you'd be referred the same day, same hour to a hand specialist, who then might decide that you could go over to the surgery center across the lobby and have a procedure done that day and everything's finished. Or you could come in and have seen your doctor for a while and decide that you need to proceed with a joint replacement. If you're a good candidate, you sign up that day, you are met with our nurse, you meet our nurse navigator, who then signs you up for our patient pathway. We'll go into that a little bit more in detail later. And you go through our prep class before that. The nurse navigator comes to your home before surgery. You pick up your prescriptions at our pharmacy, and you come to surgery and all your durable medical equipment items, and then you come to surgery in the same location and go home that day. So again, we hope that this is, it's a lot less time the patient has to spend inside a surgery center compared to a hospital, and we feel like we can really provide the best quality of care.
Great. What would you say are some of the key opportunities for this facility?
So as you named off a lot of opportunities in the ASC market, we all know this is a hot topic, and we also all know that all practices are different. Ours is a single specialty orthopedic practice where all of our doctors are subspecialized, meaning the shoulder and elbow arthroscopy physicians only do shoulder and elbow arthroscopy. The foot and ankle surgeons only do foot and ankle surgery, and so on. We have 2 spine specialists that only do spine surgery. So for us, we had to look at our business and decide, filter down the huge list of opportunities and decide what are our key opportunities for our facility. And we, kind of set them into 3 buckets, right? So one is to work closely with the payers or partner with your payers. We were able 4 years ago, we partnered with Blue Cross Blue Shield and piloted a value-based care program, which again, we'll go into in a little bit more detail later. We were also able to renegotiate our contracts with all the major payers for carve-outs for total joint procedures and spine procedures in our surgery center. As we know, with advancements in technology and surgical precision and training, and you can do higher acuity cases very safely with fewer complications and less costly than you can in the hospital. So patients really are happy to jump on board if you can present the correct data. We also wanted to partner with our vendors. We did go with a sole source for our total joint implants. We have pretty much a dual source for the, sports arthroscopy and trauma physician for implants, and we use Cardinal Health for our supplies and disposable. And we've used Cardinal for, over 4 years now, and they've been very instrumental in helping us as we've grown to, doing 600 cases a month here at the surgery center, and establishing trends and forecasting what those trends, what those trends will be. And then finally, like we spoke about earlier, we wanted to partner with our patients. That is the center of our, that is the utmost goal of our whole organization, is to provide the best quality of care, that we can to our community. So when we began our first surgery center, we hired a nurse navigator, like I said, that is able to go to all the patients' homes that are having these higher acuity cases and evaluate their home environment. We also enlisted what we call a patient pathway model. So the patient signs up for an electronic pathway, meaning up to 30 days before surgery, they will receive text, emails, video updates from their surgeon and surgeon's team up to the day of surgery, and then following 90 days after that through what we call in value-based care the episode of care. And in that, the patient is also able to, text back a question or send a picture to the doctor's team without having to go into the office or even, deal with leaving a message and having them call back and the normal ways that you would get in touch with a busy doctor's team. So again, those were our key opportunities, and we had to look at those and evaluate, how can we do this better and more efficiently.
Well, I know that you increased the size of your facility, I believe more than doubling. But aside from just increasing the size of the facility, how did you grow the practice? What changes occurred?
Yeah, absolutely. So a lot of that is regulatory based, as well as our doctors are big believers that, we have they own, the ASC. And so we know the employees have been here for a while. They have trained teams that are with them. They're very consistent teams. And that provides a lot of value and a lot of efficiency just organically. And for our practice, you mentioned the industry average is 60% of procedures are outpatient. Last year, about 63% of ours were outpatient, and we have, our pro forma for next year, if Medicare, comes through and does approve total needs for the outpatient setting, that number will move to 73 to 75% of all 11,000 surgeries that we do as a company will be done in the ASC. So we really wanted to look at how can you grow, a lot of these doctors have been in practice for over 20 years, so they really can't add more patients. They do more surgeries than anybody around, and, we deal with the reimbursement, decrease every year. So we really had to start, we gathered data. We are a research-based practice. They conduct research all the time, so data is no stranger to our practice. And so really started looking at quality measures and how we could present that to our payers. And after a couple of years of data is when we approached, Blue Cross Blue Shield, and they endorsed it, highly to begin outpatient joint procedures. So again, growing the practice in moving more cases to the ASC where we have better control of the patient experience. We really wanted to include our whole team. This with constantly changing regulations, you have to enlist experts in all areas, that being Medicare, even Medicaid is different a little bit. You've got to look at your commercial payers, and we have a wonderful team of leadership that are true experts in that.
Thank you. I know that building a facility from the ground up is no easy task. Can you share a little bit about that process of designing the new ASC and who all was involved in those decisions, and how did you make it efficient?
Yeah, so I have to say our CEO, Glenn Silverman, had this concept when he took the CEO position about 4 years ago. There was a tract of land here on Lakeland Drive, and it was his vision, and he presented it to the doctors, who are the, sole owners, and they are the only, voting shareholders, and the doctors 100% unanimously approved it. And at that point, we began asking questions, if you could have anything in your surgery, in your OR, what would that be? What would it look like to have a campus-based model where you could have clinic for half a day on one side and walk over and do surgery for the rest of the day instead of driving 30 minutes across town to your surgery center? So we really had to decide, what does that look like for us? And then involved everybody from IT to, nursing directors to managers to, the nurses, and figure out what worked best for us. And then we enlisted a design firm that really just understood our vision, our goal, and objective.
I know we touched on it a little previously, but what role do you see value-based care in the future, and did that influence the strategy or design of your new facility?
Absolutely, 100%. So value-based care is here, it's coming, and it's already here, actually. As I mentioned before, I'll expand a little bit about our bundled payment for joint arthroplasty and spine procedures. We piloted this program, and it's turned out to be extremely successful. And I say that because we all have to work together, and the end goal, again, is the patient quality of care. So in the end of the day, we're paid based on the patient getting better. So everybody has a vested interest in doing that. And we know that's the wave of the future. That's the way it should be. You've got to really partner with your patients and payers in that. Looking at the billing and the revenue cycle side of things, we have hired a lot larger revenue cycle to deal with some of the nuances that go with the different payers and follow up with that. So in a bundled model, oftentimes the facility is the primary biller, and so we will receive the most of the payment up front, and then have to disperse those funds according to how we've contracted with our partner providers, whether that be anesthesiology, the surgeon, the assistant, the post-op x-rays, the home health, and the physical therapy, post-op physical therapy. So it really is a bigger administrative burden for the surgery center, but in the end, having it all bundled together creates a much simpler patient experience where they only receive one bill. They don't receive, 10 bills like you would at the hospital. Having in-house pharmacy has been a tremendous help to the surgery center in that, our pharmacist delivers the drugs to the patient on the day of surgery and is able to answer any questions they have. And then having our partner therapy providers around town as well as in-house, because the patient can choose to go anywhere, but if we can partner with the biggest groups and feel like that they truly understand what our physicians' protocols are and stay on top of the most current evidence-based care, then we've set that patient up for success.
Well, I know that one of the biggest challenges I see in the ASCs is the lack of space. It seems to be a universal issue. How did you address that issue when you were building your new facility in the thought process of increased supplies for the increased amount of surgeries you were about to do?
Yes, great question, because when we began the design, the blueprint had a lot bigger storage area than we ended up with, because as you know, in the construction process, there are always changes that need to be made. In our case, we added 3 Class A operating rooms for smaller procedures. So those are, set aside for smaller local anesthetic cases. But anytime you move walls around, another room has got to get smaller, and usually that's the storage space, because we all know that storage space square footage does not make any money for the surgery center. So we, again, in managing that space, I have to commend, the doctors in our practice are the true leaders. They lead us not only in the latest and greatest medical techniques and in teaching the best fellows, but they also lead us in the most cutting edge, surgery techniques and even the business model of the surgery center. They're very involved in that. The adult reconstruction specialist agreed to go with a single source for the vendor. As we all know, the implant instrumentation required for a total arthroplasty is just extravagant. If you didn't have one sole source for that, it would be extremely difficult to have the necessary equipment in the surgery center to provide the, everything that's needed during one of those cases. We do have a dual source for our sports arthroscopy, and with a few outliers, we try to use the 90-10 rule on that. And the reps for those companies are here every day. It really is a true partnership. And then I bring in Cardinal Health for the PAR levels. Our materials manager, Jessica, has done just an extravagant job in organizing the whole entire move and also making do with the space that she was given and planning for the future cases. For example, in August last year, we performed 300 cases in 4 rooms, and this last month we did almost 600 cases. So it's been an enormous increase in disposable supplies that have to be delivered. So Cardinal and the team that helps us out was able to really forecast that and help us to be educated in our increase at that PAR level, because you also don't want excess inventory. I think historically hospitals and healthcare facilities have, stocked an abundance of supplies for a number of reasons. Maybe they don't want to run out, or maybe every surgeon uses a different type of disposable or a drape or whatever that may be. But trying to work toward the idea of just-in-time ordering. So at our old facility, we had 3 times a week delivery. At our new facility, Cardinal was able to help us with minimal change in workflow to increase that to everyday delivery, which has been great all around. Another reason is because we might have an add-on case or 2 the day before, and to be able to be assured of plenty of supplies just in time for surgery is the utmost goal.
So I understand that you made this move basically over a weekend and you did not miss a day of surgery. How did you accomplish that, and how is Cardinal also able to support you in that transition?
Yes, we're still breathing from that fun weekend we had. We decided this is about a 2-year construction process, and as we neared the end of we saw the end coming near a few months before that. I talked with our wonderful clinical director, Shannon Horton. She's our director of nursing, and then Jessica, that's our materials manager, and she helps out a lot with the planning and organizing. And along with the physicians, who of course don't want to miss any surgery, and we don't want to either for that matter, decided it would be best to try to get this done in one weekend. Let's rip that Band-Aid off and get it done. So about 3 months of planning did go into that. I credit Shannon and Jessica and the whole entire staff. We had schematics of the new facility everywhere in the old facility, with every piece of equipment numbered. We even stocked the supply room in this new facility before we moved in anticipation of being ready on that Monday. We did have extra supply for a few days. And, then when it came to that weekend, we did about 10 cases on Friday, June the 14th. And we closed and had our local white glove moving service come, and everything was moved on Friday. The staff worked tirelessly throughout the whole weekend to get everything set up and ready. It was actually a great team building experience, actually. If you get the opportunity, everybody was here and worked together, and to see the morale and the boost, and also, everyone, this is their facility. They have a piece of this, which, makes it really, everybody's so proud. I'm so proud to have them here. We're all proud of this facility. But Cardinal did really help us, again, in increasing our PAR levels with not just educated guesses, but true forecasting they were here helping us move. They were able to provide things other than just disposables as well. We have our OR back tables were easily delivered from Cardinal, and Cardinal provided our pre-op desk, our charting desk there. You name it, you can find it there. And the other hurdle that a lot of maybe clinical staff may not think about, but is the billing and reimbursement and the regulatory side of changing an address. Our plan was to maintain the same MPI and all of our credentialing numbers and just change our address. And that is a process that can't be done in a week. So we did took about 2 months before, and then the first month we were here just to make sure that Medicare and AAAHC and all of our payers and, everyone, the address change was a seamless transition. And so that is something you have to work through painstakingly, a huge amount of detail, but it will work.
Well, Meredith, I know that you mentioned partnering with Cardinal and, able to provide capital equipment as well. There's some additional things that Cardinal can do to not only support transitioning into a new facility, but also into existing facilities. We're sort of a one-stop shop, you could say. We would, provide pharmacy. We can do a doc-to-doc assessment to help you with your supply chain, your space usage, our delivery system of OptiFreight, providing connections for other vendors if needed. And one of the big things that we do at Cardinal is the custom packs. We're able to come in and look at your packs, go through them with the staff, try to delete any waste that's occurring and make them as efficient as possible. As far as space in the ASC, that is really helpful because the more you can provide in the pack, not only removes excess from your shelves, but it is more efficient when pulling cases, as well as improves your time for turnover, which we all know is so important to our surgeons. So we're glad that we were able to partner with you on this venture.
Yes, thank you.
And since you've been through it and survived, what would be your advice or best practice that you would offer to others that are considering building a new ASC or are currently in that process?
Yes, obviously do your research, really look at your practice, doing a detailed pro forma to see, for orthopedics, it's a little bit easier to make that decision to move forward, but maybe a different discipline they have a different needs or different margins per case or different, whatever it takes to make your center profitable to build a new center. And then including everyone in the process, I have to give, our doctors are, like I said before, extremely involved in all the decisions here. And these guys are 100% supportive and obviously all in. We're able to include incredible feedback on things, in the OR, as well as even the way the sign of the building, looked from the road. They're interested in everything. So the first step would be, involving everybody to see what that looks like that we talked about earlier, and then hiring a design architect firm that truly understands your vision. We're so proud of our facility and that you walk in the lobby and it doesn't seem like a medical facility. We wanted that, and I think they helped us accomplish it really well. And then hiring a construction firm that has experience in the healthcare industry, building a surgery center. Their regulations have, CMS has made it very difficult to comply with the requirements of any kind of surgery center, simply with the size of the rooms or the life safety codes that are required, not to mention, accreditation and what that requires. Now we're basically a mini hospital, so there is a lot of expertise that has to go into that. We hired a consultant who is very well versed in not only what's needed, but also in who in the state is the best at doing a certain thing that needs to be done. And then just, again, getting continual feedback. I remember the day that the construction company had a virtual OR where the surgeons could each walk in and put on a pair of goggles and step into their virtual operating room and look at where the lights are and the booms and the back table, and we had the dimensions of the Hana bed and the Jackson table and everything in there, as well as the amount of people that they like in that room even, so they were able to say, no, I want to move it over to the right foot, or it needs to be on the other side, or, really was able to prepare us for anything, once we got in that couldn't have been changed. So just continue to seek feedback from everybody, and it's been a great process, and we're super proud of the facility. We think we welcome you to come visit.
Well, and I'm delighted that I had the opportunity to be here. It is a beautiful facility. You guys did not miss a detail. I think what is, definitely the wave of the future is how this facility is set up. And what I like the most about it is that it is truly about the patient and the experience that they have when they come for a procedure. So with that, thank you so much, Meredith, for your time today and joining us on this webinar.
Thank you for having us.
And we will go back to Beckers for the Q&A portion of this webinar.
Thank you, Helene and Meredith, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. We have a lot of great questions that have come in today, and the first one is for Meredith. Someone's asking, did you ever think about staying in your previous space and expanding that facility?
Yes, great question. So our previous space, we leased it, so there were a few challenges when thinking about that, but there were other barriers that we really couldn't control. For example, I mentioned CMS and the regulations around decontam and central sterile. Our space was not big enough to expand, to add any ORs to that without just building an extremely, very costly building next to that. So the workflow, the way the patient walks in and goes to pre-op and then the operating room and then recovery, it just didn't really work for us, and we felt like a de novo center, and also adding that campus-based model for us was a big opportunity that we didn't want to miss.
Great, thank you for that insight. We also have an audience member who's asking, do you partner with local healthcare systems to strengthen your referral base? And how do you encourage system-employed PCPs to refer to you as opposed to hospital-employed surgeons?
Right, that's a great question. We have our director of marketing is really our liaison with our primary care providers. So she's out every day visiting, these men and women in urgent care and family medicine, internal medicine. We've recently begun doing robotic total knee replacement here, and we've been able to market that, and it's she's been a big factor in helping us do that. And she is able to get us, we actually use a system called NextDock, which has been extremely beneficial in helping our referrals and tracking those and where they come from. So they are able to, not that, other providers don't have to call our phone room, they can simply, they have a direct line to refer a patient and obtain an appointment.
Thank you. That's really interesting and helpful to know. And someone else is asking, do you keep patients overnight in your ASC for 23-hour observation? And if so, do you recommend this?
Yes, that's actually something that we began when we moved. We have 4 rooms that are equipped with hospital beds and locked cabinets and things like that are required to keep patients for 23 hours. We do that when the doctor decides after surgery that patient needs to be monitored, and it's really increased the the surgeon's confidence in bringing a certain patient here that is a good candidate, but maybe it's a 2-level ACDF patient that they just want to make sure is monitored for 23 hours and by experienced staff. and it's really worked well. I do recommend it. I think the biggest benefit is preparing for what we anticipate, which is, total needs in the Medicare population. And with that will come, other medical conditions, diabetes, other high blood pressure, sleep apnea, things like that patients really would benefit from that 23-hour room. And where we're located in Mississippi, we're very central, but we have patients come from all over the state. So it also expands the, ability to select patients for the ASC, because if you drive from 3 hours away, and then that there's the opportunity, if needed, to stay overnight for observation, then it's a lot easier to say, of course we can do your surgery in the outpatient center as opposed to the hospital.
That makes a lot of sense. Thank you for the great response. Another audience member is asking a very good question about joint venture ASC models. They're wondering, do you have a joint venture ASC model or an example in which the surgeons are employed by a healthcare organization and the ASC is owned by that same organization? And they want to know if you can share how those models are set up so as not to violate any Stark laws or safe harbor terms.
Yes, absolutely. So we are wholly owned by our parent company, Mississippi Sports Medicine. And what the Stark law dictates is that the distributions from the surgery center are shared equally among all the partners. So that is the way that we distribute earnings, is equally among the partners. So there's really, Stark law is that, there's not that much you can do to get around it.
That's a great point. Thank you. Another audience member is asking, did you have engagement from your supply chain department during this project prior to go live? And if so, is there anything you would recommend for supply chain to do better during planning or implementation phases of the project of this kind?
Yeah, absolutely. I mean, this whole, like we talked about today, Cardinal is, they provide the bulk, the 99% majority of our supplies. And they were very involved with us. They're here at least weekly, checking in with our materials manager. We are constantly evaluating ways that we can alter our custom packs according to physician preference or new items that may be on the market. We, the other vendors, maybe for implants or, even capital equipment vendors that we purchase things from, were, yes, very involved in the process. We began purchasing equipment and decontam equipment, anything like the arthroscopy towers over a year before we moved in. And then in the last 6 months, I would say, Cardinal really helped forecast. We had another 2 rooms, so we did have 6 rooms total. They were just in different locations. So we basically combined those 6 rooms and then expanded into the current facility. And as we know, just simple economies of scope, when you bring things in together, you can find better efficiencies and, the best ways to do things. And Cardinal is able to come in and take a detailed dive into everything that's in those custom packs, as well as the extra items that are ordered, and see, we look at our hand packs, for example, in detail. We have 3 hand surgeon specialists, and recently we went through and said, you know what, we could save $30 a case if we dropped this drape and we added these, smaller, napkins or whatever they would be called for a smaller hand procedure. And all 3 surgeons unanimously said, well, of course, that's a great idea. So it's a matter of just taking a deep dive into each individual pack and then, getting those surgeons together and agreeing upon how to make that more uniform.
Great. It's really helpful hearing your experience with that area. And can you also share with us how many physician partners do you have, and is there a strategic plan for replacing retiring physicians or ones that leave the area?
Yes, we currently have 16 partners and 1 physician that is on 2 physicians that are actually on it. So it's 15 partners. One just retired and one just began a few weeks ago. They'll be on the partner track. It's usually a couple of years. And yes, so we begin recruiting a couple of years before the partner decides to begin retiring. And, hopefully by that time that, we would have that position filled. It's a very, I would say our practice is very unique in that we truly have, fantastic surgeons. You have to be committed to, the educational side of it with the fellowship program. Every Friday night, our surgeons are on a sideline, every single one of them at a football game, including our fellows. So it is definitely a commitment. So as far as a plan to with the retiring physicians, I would say yes. And actually, the physician that's retiring has a huge say-so in that. I mean, for example, up until the latest surgeon retired August 31st, he was in every single meeting, and he's still a big part of our, advisory board and a big part of our practice.
That's great to know. Really interesting. Thank you. We have another audience member who wants to know, what is the 90-10 rule?
Yeah, so I say the 90-10 rule, and that is 90%. If it's a single source vendor we're talking about, then 90% of the implants or supplies or whatever you're doing comes from that one vendor, and then you may have up to 10% outliers. Of course, you're going to have cases where a physician needs a specialty product that maybe is only available from one source. So then, of course, you can go make that available. But you want at least 90% of your, policy, procedure, your norm to be what you plan that to be.
Great. Thank you for clarifying that. We also have an audience member who wants to know, payers have generally struggled to recognize the ASC quality role in the ASC value proposition story and translate that into appropriate joints, carve-outs, and other revenue reimbursement. So have you realized success here, and if so, how?
Can you repeat the last part of the question? How do you realize
success in translating ASC quality into appropriate joints, carve-outs, and other revenue reimbursement?
You realize success here. Okay. Well, we actually, like I said, we've collected data for years, and everyone knows it costs less money to do procedures in the ASC. We believe we can provide better quality, but the issue is to prove that, right, with data. And proving a quality measure with data is sometimes difficult to do. As a matter of fact, with our bundled value-based care program with a local payer, that local payer still calls every single patient that goes through the program and asks them what their experience was like. So the payer is finding out this information. We do a lot of things to try to help that along. We do seek feedback from every patient that comes in and try to follow up with them to see, how their experience was and how we could improve. That's always a continual question. But we've got 5 quality measures that we set out with our value-based care model that we monitor, things such as return to work, a quality of life score, pain level, things like that we can look at to objectively measure value.
Right. That makes a lot of sense, and thank you for sharing. It looks like we have time for a couple more questions here. We have someone who wants to know, was there a reason you chose to build in the location you did?
Well, there was availability here. Lakeland Drive, our location, is a growing area of Flowood. It's actually Highway 25. It's a major corridor for traffic. So we already had an office in Flowood, and that office stayed very busy and provided great access to patients in this area, this zip code. So it just sort of made sense as far as an objective and evaluation of where to place it. Our main office is in downtown Jackson, and then we have offices in the surrounding cities in Madison, and then also here in Flowood. This land was available, and it was a prime place to put a campus-based surgery center. So that's why we did it.
Great. That's really helpful and interesting, the reasoning you chose that location. And we'll wrap up with this question here. In your opinion, has the new facility helped to attract more patients, staff, or physicians?
Absolutely. In fact, we are located next to I won't use the word, but a place that, where you get your oil changed and your tires rotated and things like that. And we've actually had, it's owned by a very large company in the Northeast, and the company called me as a, they're a self-insured, employer, and said, our patient wants to come to your facility. How can we do that? Our employee wants to come to your facility. How can we do that? So yes, people do. It's great. We had a grand opening a few weeks ago, and that was a grand opening in conjunction with the retirement celebration for Walter Shelton, one of our founding partners. It was a great success with members of the community coming in to see the location. We actually, during the grand opening, we opened the ORs, so they were able to walk through the operating room, and we showcased pieces of equipment when they in each room, and told a little bit about that. So, again, just trying to be out in front and educate the public on what we do, and, who we are, what we stand for. And, of course, everybody, wants to come to the latest and greatest, but it does attract people here, yes.
Awesome. It's great to hear about the success you've had, and thank you for providing such informative responses. It looks like that is all the time we have for today. I want to thank Helene and Meredith again for their excellent presentation, and Cardinal Health for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.